For the 14th straight day, Joseph Rubash is headed to a hospital room at Sanford Bemidji. He's an 11-year-old boy who brightens the day of every person who comes in contact with him.
He's a real loving boy. He loves to hug and tell us that he loves us, and really gregarious and outgoing.
Joseph is stage 2 for type 1 diabetes, meaning he does not yet need insulin, but his blood sugar levels are abnormal. Joseph is just the second patient in the entire country to be treated with a brand new drug called Tzield, which became FDA approved at the end of 2022.
This drug is not for people who need insulin. If you need insulin, you have diabetes, and this drug is not for someone who has diabetes yet. But diabetes is an autoimmune condition, meaning your body is developing antibodies that are destroying the cells of your pancreas that are making insulin. So the theory is if we can remove those antibodies before they fully destroy the cells of the pancreas that make insulin, maybe we can stop it before it happens.
Joseph's parents have always known their son may develop diabetes. Joseph's father, Joe Rubash, is a type 1 diabetic himself and has an insulin pump to help regulate his blood sugar. Joseph was not eligible for clinical trials due to his Down syndrome, so the Rubash family could only hope for an approved drug. When Dr. Lewis Cassis called about Tzield, they jumped at the opportunity.
Every day without insulin, every day without having a high blood sugar, low blood sugar, or hooked up to the pump is a gift.
It was just an amazing thought to think that Joseph might be eligible for that type of medicine. And Dr. Cassis really, he was such a strong advocate for Joseph to receive this medication, and was just all on board and all excited about the possibility he could have it.
In clinical trials, Tzield kept type 1 stage 2 patients from developing stage 3 diabetes for an average of about 2 years. This would keep Joseph from needing insulin, but it could also buy enough time for future scientific breakthroughs as well.
The future is full of hope. When we look at something like Tzield, we never imagined that would be possible. We hoped for it, but now there's an intervention. We can do something potentially to delay that onset, and who knows in that 2 years what's going to happen, what'll be developed next to maybe further protect those cells.
The family is also incredibly thankful that they were able to come to Sanford Bemidji for treatment, which is just a half hour away from their home in Walker, Minnesota.
We're not flying to Baltimore, we're not driving to Rochester, we're not having to go to Fargo, it's right here in Bemidji.
That whole stress was just relieved, where we could focus on helping Joseph get through the process and stay home. You know, to be able to go home at night and sleep in your own bed, I mean, that's best for the patient.
Joseph spent most of this day smiling and chatting with his nurses. He gave them letters thanking them for their help, and big hugs too. He also got a new stuffed otter and some balloons to celebrate his final treatment. Thanks to the efforts of doctors, nurses, pharmacists, and so many others across the Sanford Health system, Joseph also has the gift of time. And now he's at the vanguard of a brand new treatment as well.
He is a pioneer. Hopefully, if we can delay it enough to one day have a treatment, that's going to be our holy grail.
In Bemidji, Jason Anschutz, Sanford Health News.